Hello, everyone. Welcome to the Premed Experience. I'm so happy you could attend the event live with us. Most of you probably know me from Instagram or TikTok, but if I will link all that info in the comments. I try to post helpful stuff for pre-meds and tips from a medical student perspective. So definitely check me out. It's at White Coats and Corgis if that's something of interest to you. And yeah, I'm so happy this event is finally here. I've been working on this for almost 6 months now, and I can't wait for you all to meet the amazing presenters I've gathered here for us today. For me, the goal of this event was to increase accessibility to experts who can help you get into medical school and eventually reach your goal of becoming a doctor. So we have some incredibly knowledgeable experts speaking today, from MCAT tutors to admissions committee members to even medical school deans. So please take advantage of their wisdom and their advice. So I know a lot of you mentioned you were interested in medical experiences abroad, and today we are going to get to virtually participate in one of these experiences. And I'm so happy to announce our next speaker, Dr. Sheetal Vora from Global Medical Brigades.
Great. Well, thank you so much for having us at the conference today. What a tremendous turnout. This is really exciting to see so many participants, so many folks that are active on the chat. And, and as mentioned, this is one of the, unique opportunities at this conference to learn a little bit about international healthcare. And what's really exciting about this talk that we're going to have today in this presentation is that we're not just going to talk about international healthcare, we're actually going to see international healthcare happen in real life form. So this is going to be a really unique opportunity to see what we do as an organization in terms of bringing access to healthcare in Central America, in West Africa, and with our programs and with the refugees in Greece. And you'll be able to see a live patient interaction. But before we go through that, and I just wanted to give an overview of who we are and what Global Brigades is. So Medical Brigades actually started back in 2003. So we're talking about 20 years ago when it was a group of students, a group of pre-medical students at Marquette University. We had the opportunity to go to Honduras along with a group of doctors from the US to be able to participate in a medical brigade. And for those of you that are maybe unfamiliar with what a medical brigade is, it's being able to have, it's really just setting up a mobile medical clinic in a part of the world that may not have access to healthcare. And so what we did in that 7-day trip is we were able to work alongside with physicians, with pharmacists, with nurses in Honduras, and also the volunteers that traveled from the US. And we were able to go to really, really remote parts of Honduras that actually have zero or very slim access to healthcare. So typically, in parts of, specifically in Honduras, in parts of the country, there's clinics, in the city. There's clinics that are maybe in the smaller, more medium-sized towns. But in the rural areas, it's a mountainous country. If you were ill and you needed to see a doctor, it'd be very difficult, if at all, to get to one. It would be, by foot, 3, 4, 5 hours. And so the idea here of this medical brigade was to truly just bring access to healthcare to these communities and bring supplies and be able to treat people for basic needs that they may have. So over the last 20 years, we've developed our mission to really inspire, mobilize, and collaborate with communities to achieve their own health and economic goals. So what makes us truly unique is that we're not just, as North Americans going into Honduras or going into Panama and the other countries that we are working in and really doing the work ourselves. We're actually collaborating with community leaders and most importantly with physicians and other healthcare experts and healthcare professionals specifically in that country to best address the needs of that country. And our vision here is very simple. It's really broad and ambitious, but we're slowly making this through, is that our vision is millions of empowered community members with the resources and capacity to thrive. So as those of you that have studied international healthcare or global health or have read something about that or have conversations with fellow colleagues and pre-med students about this, we know that global health is more than just being able to hand out medication or see a patient here and there. It's also being able to provide resources, education, and really approach an individual from a multidisciplinary multidisciplinary approach to be able to be advocates of their own health. So moving on, what does it mean to be involved in international healthcare? So, what's really important is that in order to truly be involved in international healthcare and be effective in international healthcare, and as all of you as pre-meds know this, it's really understanding the cultural context. You know, a country a country like Honduras is completely different than the US, right? And it's very different than its neighbor Nicaragua. And so really understanding the cultural context. And as many of you in your pre-med path, you know, a lot of it has to do with bedside manner, really understanding the families, understanding the patient, you know, some of the factors that they are overseeing here that could address and could contribute to their health issues. And so that is such an important part of being involved in international healthcare. Also, it's important to know the resources, right? Each country and each in all the partners and the government and such, there's different resources that are available in these particular regions. And so really truly understanding what are the resources available, how can we tap into those resources, who do we need to partner with as healthcare professionals and as aspiring or existing physicians, and really being able to understand those resources to then bring access to healthcare, right? So here, you know, in the US or wherever you're dialing in from, you know, if we get sick, we're able to go to an urgent care center, right? We're able to talk to our doctor, we're able to do a telemedical visit, right? And in many parts of the world, in terms of international healthcare, access is truly just not there. And so being able to understand the resources to then bring access is such a critical part of international healthcare. Also, improving health and achieving equity in health is such an important part of healthcare. And then also just the systematic consideration of all factors that contribute to health, right? So here are the 3 regions that we work in as Global Medical Brigades. In Central America, we work directly in the communities by creating or really establishing a mobile medical clinic day within these communities. And we're going to see a little bit of what that looks like in a few minutes. And then also we have urban clinics that we're going to actually dial into today. And we're going to see a patient interaction of our urban clinics, specifically in Tegucigalpa, which is the capital of Honduras. So those are some of the areas and how we work with healthcare, specifically in Central America, amongst our other countries. You know, in West Africa, we are in the country of Ghana. It looks a little bit different there. So in Ghana, specifically, you know, there are posts called chip zones. So chip zones are basically little health posts where healthcare professionals, nurses, sometimes a physician, sometimes, you know, some sort of healthcare expert, healthcare provider is actually physically there at the post, and you're able to get your health addressed, right? And you have that access to healthcare. So that it doesn't happen on a daily basis. It's there, you know, on a frequent basis, but not on a daily basis. So certainly something to think about. And then also what's interesting about Ghana is that the government of the country does provide insurance and medical insurance to citizens of Ghana, right? And so our goal and our collaboration and partnership is to really educate the team or educate the community members about that access and really set them up and being able to utilize that resource, right? So going back to understanding what resources are available and how can we actually bring those resources forth. And then specifically in Europe, we are in the country of Greece, and it's a very unique program that we have. We are working with the refugee population in Greece. And so we have an actual urban clinic, a clinic in Athens, in which the refugee population that, you know, that have been removed from their home countries and are in a brand new country, they're able to get healthcare on a very, very trustful, good basis. Again, with all of the different things that, you know, the refugees have gone through from a mental and physical side of things, you know, the clinic in Athens really truly addresses that in a multidisciplinary approach. So, you know, again, healthcare around the world in Central America, West Africa, and Europe, you're just seeing a wide range of people. You're going to see a lot of interesting diseases that are very different than what we may see here in the US. And it's really truly preparing you for medical school. You're learning, you're being able to shadow physicians. You're able to shadow other healthcare experts. You're able to build clinical hours. You're able to also use a lot of critical thinking when it comes to, you know, addressing the health of a particular patient within that community. So, I just want to talk a little bit about the holistic model, and what's so important about this is sustainable healthcare. When we're talking about international healthcare and being able to bring healthcare to remote areas of the world, the one word that we really, really harp on is sustainability, right? We want to make sure that the healthcare that we provide is not just a one-day thing. It's not just, a few hours and then after we leave, right, that patients won't have anywhere to go. Sustainability is key. And so within our medical program, within Global Brigades, what we do have, in addition to the medical brigades and mobile medical clinics and the urban clinics that we've talked about, is that we also have a community health worker program, which is allowing local volunteers within each community to be advocates of health. They're trained to do first aid. They're trained to be first lines of care when it comes to healthcare access. And when a medical brigade isn't there, the community health workers are actually the leaders that the community members go to if they need medical or healthcare assistance. And then also we have programs like the patient referral program. Oftentimes, as you can imagine, during a medical brigade, there may be limited resources, or we may have run out of medication of certain things, or there may be a patient that comes in that we aren't able to directly address their issue at that given time. So our patient referral program truly takes that patient profile and takes them through the entire process of getting the treatment that they need. So sometimes we see people with chronic issues. Sometimes we see people with individuals that may need surgery, and we're able to take them through the patient referral process to get their issues addressed. And then we also have a dental component of our medical program, where we're actually addressing dental issues within the communities, from really basic things like pulling teeth and pulling cavities for those that are in pain, to a lot of oral health and preventative oral health in terms of the overall picture. And also within the organization, we do focus on economic development opportunities, which is a huge contributor to health. And then also, the most important for all of you as pre-meds, as you know, is that if you don't have clean water and if you don't have a strong public health infrastructure, that can lead to illnesses. So what we do see is a lot of individuals within the communities that we are partnered with. If there's a water system that is contaminated, or there's no clean water, you're going to get sick, right? And so we also address that issue, the root of that issue, which is so important in terms of multidisciplinary approach, to have water and sanitation infrastructure, bringing clean water, bringing public health solutions to a community so that they don't have that ongoing issue overall. And that also becomes a long-term supporter of their overall health as time goes on. So looking at, if you're a volunteer, right, looking at the volunteer impact. Now, many of you may think as pre-meds, well, what can actually happen in 7 days? Can I actually make the impact? Yes, the answer is absolutely yes. So, during a medical brigade, what we're able to do is, as a volunteer, you're shadowing, you're building clinical hours, you're working with local physicians, you're working with local pharmacists and nurses, and learning the ropes to prepare you for medical school, right? So you're learning how to take vital signs alongside with the professionals. You're also participating in what we call charlas in Spanish. Those are basically called workshops, and where we're absolutely able to educate community members about very important topics like the importance of hand washing, the importance of managing their chronic issues, like how in this particular picture you see charts about the components of high blood pressure, the components of asthma, right? These types of things, this basic knowledge just isn't there within the community. And so as a volunteer, you're able to do these workshops with translators and be able to truly educate community members, while also being able to understand the lay of the land internationally, right? Being able to communicate with community members about questions they may have, and doing these workshops to address the issues firsthand from an educational side. And then, one of some of the other areas in terms of volunteer impact is being able to, what's so important, being a pre-med and then eventually becoming a physician or a healthcare professional, is knowing how to interact with your patients with a lot of care, with a lot of empathy, and being able to really connect from a human to human level when it comes to that patient, when it comes to that, individual interaction. So that is a tremendous amount of what's coming out of that volunteer impact. So typically when you're in a medical brigade within a community, you're seeing a little bit of a flow. It's almost like a kind of like an assembly line, so to say, just in terms of visualizing this. So, the first area is intake. That is where the community members are typically lined up. The organization informs the community that on these dates, a medical brigade will be happening. So the community is prepared. The community health worker also informs the community that the medical brigade is happening. And so at intake, that is when we take the name, the basic information about the individual so that we can record that patient's quote unquote file, right? And then the triage station, we're taking vital signs, we're taking height, weight, all those different things that are important down the line when it comes to the patient consultation. Then the patient moves onto the consultation side. So they're actually sitting with a physician and they're being able to share what their issues and ailments are. And then from there, the physician and healthcare professional is able to provide an appropriate diagnosis. And so as a volunteer, you're able to be a part of that interaction, learn, see how the doctor-patient interaction, how important that is. And then also, from a critical thinking side, you get to learn a little bit about, okay, these are the presentations of these symptoms. And so, what do I think it is, and be able to collaborate with the doctor and be able to critically think in that way. And then we have a few specialty stations because these are very important stations to, again, address the patient from a multidisciplinary area. We have a gynecology station where physicians are able to provide pap smears and other female health related expertise there. Also our dental station, which we talked about a little bit earlier, is being able to address the oral health. Oftentimes we're doing dental extractions, fluoride treatments, things of that nature to be able to address the dental issues firsthand, acute dental issues firsthand. And then our vision station. There's a lot due to the climate. Many of the individuals, specifically in Central America and in West Africa, have vision issues. They may just need reading glasses, right? Or something a little bit more. And we have a vision station to be able to support them. And then from there, as we talked about, there's the adult charlas, which is the workshops where you're able to educate the patients and educate the individuals of the community of very basic but critical information to be advocates of their own health. And then also the pharmacy area is where they actually, during the consultation, they will receive some sort of diagnosis and possibly a prescription if medication is needed, and they'll be able to actually fill their prescription at that pharmacy. And then the last station is data informatics. We do digitize all of the information of our patients, and so that we're able to see trends, and then most importantly, we're able to follow those patients on a direct basis. And so this next video here, I just want to show you just a minute or so of, we kind of talk through this flow of what the medical brigade looks like within the community-based setting. Again, very different from the urban clinic that we're going to be seeing in a few minutes here. But in terms of that, if you go on to the next slide, there is just a really brief video of what a medical brigade looks like. And so I'm going to do a little bit of narration here. Typically, a medical brigade is happening at a local school of the community, sometimes a church if there's no school present. You can see here it's pretty rudimentary but highly impactful. This is the intake and triage station. Then you go into one of the rooms of the actual school, which is the clinic, right? And you see those various tables here where you are getting, the patient is getting consultations by the doctor. And then down the row here are different areas. This is individuals waiting either to be seen or waiting for to get their dental and vision screening done here. So everything is very much kind of similar to a clinic, that we would see here in the US of, different rooms have different specialties. And so there is a very nice flow to this. And we bring our own equipment. As you can see, this is an autorefractor to be able to see the prescription for potential eye issue, to understand what glasses would bring them to clear vision. And the dental area has all of the various dental equipment to be able to do the extractions and such that an individual may need during the medical and dental brigade. And then from here is the charla station. This is, again, very classroom style. We like to keep it really dynamic. We want the community members to be involved in this and to feel really great about this. And this is what, just a nice little visual of a typical group, a group of about 25 students. So we've talked about this, but now let's zoom into Honduras.